Okay, so another step that is critical after this has been done is how you are going to dry this dentin. Now we have a wet sample of dentin. Envision this being done in the clinic, right? There's a thin film of water covering everything, as you can see. The tricky part here is going to be to achieve different levels of dryness in the two tissues. Okay, so we have enamel, which is okay if it's over dried, but then you have dentin, which cannot be over dried. In other words, you've heard me say in lectures before that what you want is to leave the dentin slightly moist. Well, what does that mean, and how do you achieve that when you're trying to give gentle air puffs to such a small area, and you have in that small area two different tissues to deal with? So this is what I recommend. So say I'm going to go ahead with the tip of the syringe and I'm going to start giving gentle puffs of air. Okay, just try to dry as gently as you can. Look at what happens. That enamel gets pretty dry, chalky as we know, but the dentin also gets dried. That's why I recommended having a second micro brush in place. What I do is I'm just gonna gently wet this little micro brush, and I'm gonna bring this. Happens all the time where you end up desiccating the dentin more than you would like, and you can take a clean micro brush and remoisten slightly that dentin. Okay, once again I have too much water, as you can see, so I go ahead and take a third clean micro brush that is dry now and try to dry the area. I'm gonna go ahead because I'm still not very happy. That's a little bit too moist, if you can see by the reflection of the light there with the water. So I'm gonna go with another gentle puff of air, if you can see. That is somewhat, that's exactly about the level that you would want of moisture, where the enamel is a little bit drier than the dentin, but the dentin is slightly moist. At this point, I am ready to apply my Optibond Solo, and you need to make sure that this is done quickly right after you've left your dentin slightly moist. Remember, that is sitting there air drying, so if I don't move fast, that's going to dry. So I'm going to go ahead and apply this into increments. First increment, why into increments? Again, 15-second applications, so you can break it down into about 7-second segment. Rub, actively rub that dentin. You're trying to infiltrate that collagen network of the dentin with that primer and adhesive. It is important that you've rubbed there your dentin for about 7 seconds. I'm going to dip this again and come back to it for another 7 to 8 seconds. Total of 15-second application, actively scrubbing that dentin to infiltrate those resin monomers into it. Acetone-based systems need to be applied in more layers. In other words, that's 3 or 4 coatings, no curing in between. These ethanol-based systems are okay to be applied in 2 layers, no curing in between. So I have my 2 layers there. Third, very critical step is look at that thick film of adhesive. Adhesives work best in thin, even layers. Those 2 words are critical. It needs to be a thin film, and it also needs to be even. So the manufacturer of this material recommends 3-second air drying. So the rule is 3-second air drying, gentle air drying, or until no further displacement of the film is visible on air application. So we're gonna go ahead and start drying. And as you can see, gently air drying. You can see how the adhesive is still moving. You need to, after air thinning this, you need to be able to see a glossy, even surface. So at this point, after we've achieved a thin, even layer, we are ready to polymerize the adhesive, which we are going to do with an LED curing light for 10 seconds. It's important always to be aware of the energy coming out of these lamps. What we have in the clinic are LED curing lamps, and 10 seconds would be good. If you were to be using a halogen or a quartz light, it is important to remember that the filters of these lights degrade over time, so the energy that may be being delivered to your tooth structure may be less than what you think. So sometimes it may be wiser to either double check the energy that's coming out of those lamps or increase your curing time to 20 seconds. After we have polymerized the film of adhesive, we would be ready to begin applying the composite, again in incremental layers, no greater than 2 millimeters.